like to welcome you this afternoon, and our presentation today is going to be on Medicaid waiver and institutional deeming. I'm Lisa Kleinbub. I'm the Executive Director here at Regional Center of the East Bay, and Evelyn Hoskins, our Associate Director for Federal Programs, and Elvia Soria Rodriguez, our Associate Director for Children's Services, will be doing most of the presentation today. I wanted to start off by telling you about a couple of things that you should take a look at if you're interested in terms of regional center services. Department of Developmental Services has a survey that they are conducting where they want to get input from people served and their families about how things are going with COVID-19 and what's going well and what things that may need to be improved. We have a link to that on the RCV website, and you can link to that easily there. It is in multiple languages, and we have links to those surveys as well, although you can access those surveys from the English one as well with a tab drop down in the corner of the screen. And so we encourage you to complete that. It's always good to get input on things that are going well and things that need to be changed and improved. The second thing I wanted to talk about, and I think everyone on the call is well aware that our area is seeing an upsurge in COVID-19 cases, probably due to the more indoor activities people are having as we get to the colder months of the year. And the state is really encouraging people to only celebrate holidays with their households, and if they're celebrating with other members of their extended family, to have those celebrations outdoors, and if at all indoors with masks on, and also with having open windows. And it is really important that we sort of kind of buckle down for the next couple of months and keep doing the good work we've been doing in the state of keeping safe. Because for those of you who will be interested in vaccination, those are probably very close, but not here right now. So it's a few more months to get through. And so I just wanted to share that. So we'll start with our presentation, and then we will have questions and answers afterwards for you to participate. So Evelyn, Elvia, take it away.
Hi, I'm Evelyn Hoskins, and as Lisa indicated, I'm the Associate Director of Federal Programs here at Regional Center of the East Bay. I oversee Early Start and Medicaid Waiver in Alameda and Contra Costa counties.
And hello, good afternoon, everyone. I'm Elvia Osorio Rodriguez. I'm the Associate Director for Children's Services here. I oversee both county children's divisions in Alameda County and Contra Costa County. And the age range, just so you know, is 3 to 22.
Okay. Medicaid waiver and institutional deeming. Medicaid waiver is a federal program which allows the state to receive federal reimbursement for some of the services provided to individuals so that they can, some of the screen is blocked, so that they can live inclusive lives in their community. There are numerous Medicaid waivers. However, the one we are talking about today is specific to persons with intellectual and developmental disabilities. In the past, services for people with intellectual and developmental disabilities were almost exclusively provided in large institutional settings. Waivers allow that federal dollars that hypothetically would have been used to fund those institutions be used for inclusive community services.
So what are the Medicaid waiver requirements? Oops. Okay. To be on the Medicaid waiver, individuals must meet all of these requirements. Must be Leonardman eligible, That means ongoing eligibility for services with the regional center. Be a Medi-Cal recipient or be eligible through institutional deeming. Use at least one billable service annually. Have an approved living arrangement, meaning a family home, living independently, or in a community care facility. And meet the level of care. And the next slide will go into that.
What is level of care? The person must have substantial limitations in their present adaptive functioning, which require the person must have substantial limitations in their present adaptive function, which require the level of care provided in an intermediate care facility, also known as ICF. And some of these could be limitations in walking, eating, toileting, bladder or bowel control, personal care, dressing, safety, disruptive social behavior, aggressive social behavior, self-injurious behavior, property abuse, running away, emotional outbursts, medical or physical concerns that require skilled nursing care or observation.
So more on the level of need. The waiver requires that there be 2 areas of need for support and that these require substantial support. So the IPP, the individual program plan, must address how these are supported. Age is taken into account, so we couldn't count safety for a 4-year-old who needed supervision in the community at all times, but we could count that for a teenager.
Some frequently used billable services, personal assistance, daycare, interpreter or translator, durable medical equipment, using the accounting code 725 only, and that's an internal code here within our regional center system. Nursing services, LVN or RN, camping services, in-home respite service agency, ILS or SLS, which is independent living skills or supported living skills, adult development center, behavior management program, and these would apply to adults only. Services are determined in a person-centered IPP process, or it could be an IFSP process if a child has been determined to have an intellectual disability diagnosis. Some services do not apply to children.
So who is on the Medicaid waiver? If the individual currently receives Medi-Cal and meets the other Medicaid waiver requirements, they may be added to the waiver. If the person doesn't currently receive Medi-Cal but meets all other requirements, they may be eligible to receive Medi-Cal through institutional deeming and be on the Medicaid waiver. You must be on the waiver to be institutionally deemed. Institutional deeming is a special Medi-Cal eligibility rule that only considers the child's income and not the parent's income. The only income that is considered is the child's, for example, child support, an unprotected trust fund, or other monies in the child's name. If the child has no income, typically the child will be eligible through institutional deeming to receive full scope Medi-Cal with no share of costs. If the child does have income, then the child may still be eligible for Medi-Cal, but possibly with a share of costs. And there are no cash benefits tied to institutional deeming.
What is Medi-Cal through institutional deeming? Medi-Cal is California's version of Medicaid, a federally funded health insurance program, usually for people with low incomes. For certain individuals, the income requirements for this program can be waived. This means an individual consumer can be considered a separate household to their other family members. Usually this means only a child's income and assets are considered, something's going on, are considered, okay, married people can also be eligible for institutional deeming. For those who are served by regional centers, certain eligibility for the home and community-based services waivers through the Department of Developmental Disabilities Services allow this through a process called institutional deeming. They may qualify for full scope Medi-Cal, possibly with no share of cost. People must meet all the requirements for the home and community-based services waiver or Medicaid waiver, except for having Medi-Cal. Although we aren't discussing this today, there are other waivers for other populations.
So a few more points on Medi-Cal. Children may already have health insurance through their parents. So Medi-Cal can act as a backup for primary insurance, but is always the payer of last resort. Medi-Cal may pay for supports that private insurance does not pay for. Private insurance may have benefit limits on certain services that, when reached, Medi-Cal may continue to pay for. And parents should communicate to their private insurance and/or Medi-Cal regarding the benefits and questions or concerns.
Medi-Cal benefits. Based on need, your child may be eligible for in-home support services. Medi-Cal may pay for co-pays for insurance coverage services if the provider accepts Medi-Cal. Medi-Cal often funds nursing services for children who need this level of care. Medi-Cal funds durable medical equipment, including augmentative communication devices, if needed.
So what is the process for Medi-Cal through institutional deeming? So our case manager reviews the file and consults with their supervisor prior to contacting the QIDP group, the Qualified Intellectual Disabilities Professional. A QIDP will review the child's file. If the child meets all of the requirements at that time, a QIDP will inform the case manager and provide the appropriate documents to the case manager to be sent to the family. And we want to make a note here that the Alameda County and Contra Costa County processes differ.
Alameda County process. After the QIDP, which is the Qualified Intellectual Disability Professional, informs the case manager that the individual has been determined eligible for Medicaid waiver. The case manager sends parents the referral form, cover letter, and Alameda County institutional deeming information sheet. Parents send all applicable documents to Medi-Cal via either the Medi-Cal website, fax, or mail. Medi-Cal sends their application to the parents. They have 10 days to complete and return to Medi-Cal. Medi-Cal will send a notice of action, also known as NOA, to the parent indicating whether or not the child is eligible for Medi-Cal. Parents notified the case manager after receiving the NOA so we can officially put the individual, their child, on the Medicaid waiver.
So the Contra Costa County process is a little different. After the QIDP informs the case manager that the individual has been determined eligible for Medicaid waiver, the case manager sends parents the referral form, a cover letter, and the Contra Costa County institutional deeming information sheet. The parents then call the Medi-Cal 800 number to request a Medi-Cal packet. The parent will receive a Medi-Cal application in the mail to be completed. The parent then submits the referral form and the cover letter along with the Medi-Cal packet as directed by Medi-Cal. Medi-Cal will provide a notice of action, NOA, to the parents indicating whether or not the child is eligible for Medi-Cal. The parents notify the case manager. This is really important because the case manager would not know otherwise. So the parents need to notify the case manager after receiving the NOA so we can officially put the individual on the Medicaid waiver.
How does the Medicaid waiver affect regional center services? Being enrolled in the Medicaid waiver has no direct effect on services. It does allow the state of California to get funding from the federal government for the cost of many services provided by the regional center. Having Medi-Cal may impact some family fees. If a child stops meeting the Medicaid waiver requirements and receives Medi-Cal through institutional deeming, then the child will no longer be eligible for Medi-Cal through institutional deeming. If the child receives any other Medi-Cal programs, their Medi-Cal is not affected by Medicaid waiver eligibility.
So individuals must be reviewed at a minimum of every 12 months by a QIDP to ensure that they continue to meet all of the Medicaid waiver eligibility criteria. This is a recertification requirement. If the child no longer meets all of the criteria, they must be removed from the Medicaid waiver and would no longer be eligible for Medi-Cal through institutional deeming. In order to support children and families, this will be communicated to the case manager so that the ID team can address any possible issues. This is where a case manager may be calling the family to get more information so that they can elaborate maybe on behaviors or some of that level of care that we talked about earlier. The local Medi-Cal office may assist with other paths to Medi-Cal.
Local Medi-Cal offices. Parents should respond to all communications from Medi-Cal. If you have questions about forms and other details, those need to be answered by the Medi-Cal staff. Medi-Cal may ask parents for income verification to ensure qualification for the appropriate Medi-Cal program. They will also ask for information about other family members in order to assure that they aren't missing other people who might be eligible. Sometimes a child will be assigned to another Medi-Cal program if eligible. Medi-Cal typically completes a yearly redetermination. If Medi-Cal asks for verification of Medicaid waiver eligibility, ask your case manager to have the regional center send those documents to Medi-Cal on your child's behalf. Alameda County Medi-Cal information.
We can post this so people can refer to it, in the future,
All right.
Go to the last slide.
Other ways services are funded by the federal government is the 1915I State Plan Amendment. For those with Medi-Cal who are eligible for the Medicaid waiver, the state can access federal funds for services purchased by the regional centers. Targeted case management. For those with Medi-Cal, the federal government provides funding for some case management activities.
Oops, you're on mute. You're on mute, Lisa.
Oh, I didn't unmute. Well, thank you, Evelyn and Elvia. We have a number of questions in the chat, and I think that I'm gonna start to read them, and then you guys can answer them. Yes, we will be sharing the slides. That's one of the questions. And then another question about sharing the slides, and Michi told people about that. The first question here, if an RCB client is eligible, will case manager advise? If I understand this correctly, it's a benefit from RCEB since funding will come from Medi-Cal. Elvia, you want to?
So yes, the case manager, during your IPP, they will try to gather as much information and elaborate on all the level of care, and they will be able to advise and consider, consultation with the QIDP, and in conversations with the family if this is something that they would like to pursue.
So the next question is, what is the process for a provider to submit a claim to Medi-Cal as a secondary insurance to pay for copays? Do you want me to answer that?
Yes.
So the provider, in order to get the copays paid, the provider would have to be someone who accepts Medi-Cal for services, and they would submit for that. One of the things that happens is when a provider knows that someone has Medi-Cal, they may not actually submit for copays to Medi-Cal because the payment from the private insurance may be higher than the Medi-Cal payment. And so they will just accept the insurance payment in full in that case. So it is of a benefit to do that. Does the QIDP review all RCB clients?
The QIDPs review clients' cases to add them to the waiver. We get a list of clients that are provided from the DDS who are reviewed to add to the waiver. And we also pull a list within our own database to determine if clients should be reviewed for the waiver. Many times, case managers will refer their clients to determine if they can be eligible through the Medicaid waiver. And the QIDPs review all of the information in the client file to help to make that decision.
So the next question is from Patty, and I'm going to ask you maybe to unmute. I'll unmute you because you say here that Medi-Cal staff is not very helpful. Can you explain what you mean by that so we can understand what the question is? Is that at the local offices? Well, if you want to put that in the chat, that's fine as well, Patty. Lisa asks, my daughter is 18 months, born with Down syndrome. She's on our private insurance. What is our first step?
Well, you would, Lisa, you would discuss and provide information to the case manager in order that your daughter's medical records and information that's been provided, all evaluations would be reviewed by the QIDP to determine if she met the criteria for Medicaid waiver. Also, and so it's good to provide as much information as possible to the case manager. Your daughter's very young, so her care needs might not be to the level of care that's required. So all information that you can give will be very helpful in that process.
Okay.
I'm going to have a chat from Maria Villalobos in Español asking, can all kids qualify for Medi-Cal independently of their medical insurance via their parents' income? So María, en español dice, todo niño puede calificar para Medi-Cal independiente del seguro médico o ingresos del papá. Okay, so tuviera que, should I answer in Spanish or in English?
Answer in Spanish and then translate for the people who speak English.
Okay. So tuviera que consultar con la coordinadora de servicios para la plática sobre qué seguros tienen y la necesidad de Medi-Cal y para ver si sería elegible para el Medicaid waiver bajo del institutional deeming. So I said that she would need to consult with her case manager to see what kind of Medi-Cal or what kind of insurance they currently have to be considered for a Medicaid waiver through institutional deeming.
Thank you. Martha's asking, what if a family child has Kaiser for medical coverage and meets all other requirements? Can the child still get institutional deeming? And let me answer that, because Kaiser is a really good example of how institutional deeming can be really helpful. So if the child has Kaiser because of the parent's employment, or it's something that they have because of they buy insurance on their own and not through Medi-Cal, then they can certainly apply for institutional deeming if they meet the criteria. And Kaiser makes it really easy if you have Medi-Cal as your secondary insurance. They take that information, and then they just automatically waive copays when they know that someone has Medi-Cal, and treat you with all those copays that Medi-Cal wouldn't have are eliminated from the Kaiser plan as well. The next question is, full scope the same as straight Medi-Cal? Evelyn, do you?
The full scope is full scope Medi-Cal. I guess it is straight Medi-Cal. I don't know if I would say it is straight Medi-Cal, but I would suggest that you contact Medi-Cal to get clear guidance related to their definitions of what that might be.
So I think sometimes there's a lot of terms that get thrown out about Medi-Cal. So I think when full scope means that you don't have a share of cost usually. There's other people who sometimes have to pay for some services before they can actually access their Medi-Cal benefits. That's often adults who have other forms of income. But straight Medi-Cal sometimes means Medi-Cal that's fee for service, which means you're not part of a Medi-Cal managed care plan. So there's different versions of that. Rosa, too often Medi-Cal staff has no idea about the Medicaid waiver. And I think, Rosa, you're talking about the county staff there. And Evelyn, do you want to talk about what our staff do to interact with the county offices and how we can be helpful?
Well, the QIDPs communicate with the county offices to discuss their processes and find out the information from them that would be helpful to them in helping them to determine if an individual is eligible for Medi-Cal. We don't determine whether someone is eligible for Medi-Cal. We're looking at whether they're eligible for Medicaid waiver, and through the process, through the regional center system and through Department of Developmental Disabilities. But yeah, we communicate with Medi-Cal. Case managers also communicate with Medi-Cal, and the parents would know their contact at the Medi-Cal office or their Medi-Cal worker. So that would be the individual that you should begin the conversation with. But the case manager, based on information that you provide, they can communicate with the qualified intellectual disability professional related to reviewing information and providing information that can be shared with Medi-Cal staff.
So Amy says, do the parents need to do anything, or does RCB take the lead on notifying clients if they may be eligible? What are they looking for? Elvia, you want to?
Yeah, so I guess it depends on what your need is. If it's an issue about Medi-Cal, then that conversation would have to be with your case manager. That's where it's very important to share as much information during the IPP process with the case manager to elaborate on the skills that a child currently has or limitations, because that's where they are trying to gather as much information so that they can then share and consult with the QIDP if we need to go that route.
So there's a question about, does an early start client with Down syndrome qualify for Medi-Cal? It's very possible. We would have to make them a status 2 individual, which means that they have permanent eligibility for regional center. And that can be done for a child in early start. There's also other conditions that we know are going to be eligible over the age of 3, so they can be made eligible if they have the needs that would fall under the Medicaid waiver. Now, Patty said there was frustration when she called Medi-Cal. They couldn't address her questions about co-pays and directed her to Department of Healthcare Services. And Patty, I agree. There is often a disconnect between the local Medi-Cal offices as well as the Department of Healthcare Services, and an understanding of how Medi-Cal as a secondary insurance works. My experience is that it's best to talk with the provider who is providing services, who usually knows how to bill both insurances. And you have to be with a provider who also takes Medi-Cal as well as the private insurance. Okay, I'm gonna read Betty's. I have a family whose child is on SSI and Medi-Cal. Family will not be eligible for SSI soon due to resources. Mom wants to go through institutional deeming, but mom was told RCB will not process institutional deeming as long as the child's Medi-Cal is active in the system. Mom doesn't want any service gap. Is there a way to avoid the service gap?
Institutional deeming is in order to be on Medi-Cal, to receive Medi-Cal, so they already are receiving Medi-Cal.
So I think that, I think one of the questions here though is, what can we do if we know that someone's about to lose Medi-Cal? And is there a way that we can assess whether or not they might be eligible for institutional deeming when they're off of Medi-Cal because of income? And can we start the process so they could tell the worker that they're expecting to be institutionally deemed as soon as they lose Medi-Cal? So Elvia, would that be something they might want to talk to the case manager about?
Absolutely, yes, absolutely, and express to them exactly the situation that you just posed, and that you're trying to avoid the gaps. And so, yes, and the sooner the better, so that the case manager could start the process on our side, and then they can connect you with the Medi-Cal office for the applications, and therefore, yeah.
And I would also expect that a child who had Medi-Cal, and if we could put them on institutional deeming, they may already be on the waiver if they met those criteria. So we wouldn't want the gap. Patty asked for clarification about copays. You cannot submit a claim to Medi-Cal for copays. Only the provider can submit those, yes. And remember that regional centers for certain services, including ABA, regional centers can also assist with copays if there isn't insurance that can do that.
Yes. I just wanted to add, just make sure that you are communicating that to your case manager, and that is part of your IPP.
Okay, I think Sonia wants to ask a question. I'm going to try to unmute you, Sonia.
I got a good child, but for my child, I receive a medical, but now I got a new income. I got HSS from my daughter. I got SSI for my daughter, and then I got child support. You think maybe the new income I got affect my medical, because I fill it out on right now the application, but I don't receive any response from them yet if I'm still receiving medical or not.
So what you're saying is that your child currently receives Medi-Cal?
Yes, it's also my daughter. She has a special needs. She got that Down syndrome.
Uh-huh.
But I don't know. The future I got medical. It doesn't matter. Maybe we could payment cover California, something like that. But they don't send it to me any letter if they prove me or they decline me. I'm not sure.
Yeah. Please reach out to your case manager and maybe they can help you with those documents. I will say that if a child loses Medi-Cal and they have, and the child has child support, it's interesting, the child support is considered the child's income. It's not considered the parent's income. So that causes a little confusion, but I don't know how much that is. So those are some questions that maybe you and the case manager can talk a little more about. So, yeah.
Okay, thank you very much.
Thanks.
Maybe other programs through Medi-Cal that they may be eligible for.
Okay, thank you.
Mm-hmm.
Valerie says, I was asked to choose between two providers, and I'm assuming that those two providers are two Medi-Cal managed care plans. And later I was told I need not choose between the two options and ask Medi-Cal to change it to straight Medi-Cal. And I think that's where, if you have Medi-Cal through institutional deeming, you are currently allowed to get fee-for-service Medi-Cal, and you are not required to join a Medi-Cal managed care plan if you have other insurance. Yeah. Okay. Okay. Let's see.
Thank you, Yanet. Yanet did indicate on the chat that as long as her child is on SSI, she will continue to receive Medi-Cal.
Thank you. Why would a client be taken off the waiver at RCB's level, and should the case manager inform the family when this happens?
Yes, they would, and before that even happens, they would reach out to see if the level of care has changed or the reasons why they might not be eligible or redetermined for the waiver. So yes, they would be notified.
So Evelyn, is the most common reason people who've been on the waiver are taken off is related to not having a billable purchase?
But it's not using a billable purchase.
Mm-hmm.
So a billable purchase must be used within every 12 months. It has to be used annually. Once an individual is eligible for the Medicaid waiver, their file is reviewed annually to determine if they still meet all of the criteria, and having used a billable service is one of those. And the provider, the vendor or provider providing that service needs to bill. So it's not just enough to say that the service was used. It also has to be billed by the provider in order for that to be effective.
Yeah. And that's something that it can be, you can talk to the case manager and look at whether or not there's something else that might support the needs of your child in order to maintain that. Elvia, can you translate?
Yes, that's what I was going to do. María Villalobos is asking, entonces, para que un niño pueda recibir servicios de ABA, ¿eso tiene que estar escrito en el IPP? I think she meant IPP. So, so for a child to receive our ABA services, it has to be written in the IPP. Yes, because in order for the case manager to have a thorough assessment of need and understand the child's situation, they would need to know why this child would need ABA services, whether it's funded from a private insurance or through Medi-Cal or through even regional center. We want to have that on the IPP so we have a really good understanding of what services are happening and what are the behaviors looking like for this child. So yes, we would encourage for that to be documented in the IPP with as much detail as possible. Hoy en español, sí, que
yeah.
esta información que esta información que esta información de los comportamientos que el niño está teniendo, todo esto esté elaborado en el IPP para que se entienda bien la situación del niño, las necesidades del niño, el comportamiento del niño, y no le hace quién lo esté pagando. Es importante que esa información esté en el IPP, pero queremos saber más de la necesidad del niño para que el coordinador de servicios tenga una buena evaluación acerca de las necesidades de la familia y de este niño. Sí, esa información es importante que lo tengamos en el IPP. Y más las necesidades o las particulares del comportamiento. Okay.
So Patty has a question about the ABA provider who accepts Medi-Cal, but not Medi-Cal as a secondary insurance because of reimbursement issues. And it doesn't make sense why they wouldn't do that. Patty, if you'd like to just send me your email in, you can either put it in the chat or you can send it directly to me in the chat, and I will have someone follow up with you about what we might be able to do to help with that. It is complicated, and some people don't want to deal with all the intricacies of Medi-Cal. I think a lot of providers are happy to work with Medi-Cal managed care plans, but not with fee-for-service. So it's quite interesting how that works. If one shifts from Alameda County to Contra Costa and the child has been deemed, will services be effective? And what's the difference in services if ABA is covered by Medi-Cal? Elvia, do you want to handle that about county transfers?
Let me read it really quick because I was reading another chat here. I got a little distracted. If one shifts from Alameda County to Contra Costa County, the child has been deemed, will services be effective? I think what's important is that you communicate to the case manager early on if and when that move is going to happen, so that we can try on our side whatever we can control to make it as smooth as a smooth transition as possible. So it all depends on what, you know, if it's ABA, hopefully the provider that you're working with covers both counties, and so it shouldn't be a problem. But we as case managers would need to know about that move as soon as possible so that we can transfer the case with no issues and, you know, make a smooth transition from county to county.
Yeah, I mean, sometimes county transfers take a little while, and it can be a process, but while you are in the process of transferring to the new county, your Medi-Cal at the old county generally stays in place. So until that transfer occurs. I was asked to choose one of the Medi-Cal providers. Do I need to ask them to change to straight Medi-Cal? You can ask them if you see it would be of benefit to switch to straight Medi-Cal for fee-for-service. You can ask them to do that, and they will work on that for you. I don't know how long it takes to do that, but that is a possibility for you at this point. And just to let you know, things change with Medi-Cal law all the time, and so you just never know when there will be a change in the law. And right now, Medi-Cal is not doing a whole lot of redeterminations because of the pandemic. So we're in a little bit of a lull on that, and things may change once the pandemic is over as well. Let me see. I see one hand raised. Let me see who that is. And Shirley, I see a hand raised. Did you want to ask a question?
She's muted.
It's okay. If you don't, that's fine. I mean, sometimes people raise their hand and they didn't intend to ask a question. I do that like when I fast forward through slides too, and I didn't intend to, but we can do that. So let me go back to the chat, and if you have any more questions, please ask them in the chat. Jairo, as a Spanish translator, will also be translating other things into Spanish for people. But I'll wait for a little while to hear if there's any other questions. But I hope you got some additional information from this. We are trying to put our materials on institutional deeming on our website so that families have easy access to that. And Evelyn, is there anything else you want to share about what we've been doing to help with institutional deeming with our case managers?
Well, we conducted a training recently to give case managers more guidance so that they can provide better and more informed information to parents related to the process. And we've updated some information sheets, some of the information that will be that goes to a parent. Oftentimes, institutional deeming is a request coming from a parent. And so the case manager needs to gather information from the parent to include with whatever documents and documentation and supporting information is in the child's case file. But oftentimes, most times, those requests for institutional deeming are actually initiated by a parent requesting to have their child's case information reviewed.
So Martha has a question. What are some concrete ways families use their institutional deeming? So I can answer that a little bit. I mean, things that are different, it's in the slideshow, but that people can get through Medi-Cal is in-home support services if their child needs assistance. A lot of equipment can be paid for through Medi-Cal. The co-pays, and I think the family fees. So depending on income, regional centers are required to assess family fees for respite and childcare. And if you don't have those services, there's an annual family program fee that's assessed. And if you have Medi-Cal, those fees are not assessed. So that is another benefit of institutional deeming. Well, thank you again, and I look forward to seeing you on another webinar. I'm trying to do them right now twice a month on Fridays, and then starting in the next year, we'll probably slow it down to once a month. And I hope you all have a happy holiday week next week. Stay safe, keep your mask on, and be good and healthy. Thanks. Bye-bye.
Everybody.